It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question from one of our readers. And the question last week was part 4 of my husband had open heart surgery with complications. He's not waking up. He needs 100% of oxygen and now he's bleeding from the stomach. I'm so scared. Help. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from our readers that we get quite frequently. And the question this week is, what are the chances of survival for a person in an induced coma? This is another great question, and it's a question that we get quite frequently from families of critically ill patients in intensive care. The short answer to this question is, it depends. On the one hand, many critically ill patients in intensive care in an induced coma who survive this ordeal will never have come any closer to death during their entire lifetime. On the other hand, the vast majority of critically ill patients in intensive care will survive. Let's first look at some figures, and most statistics in intensive care suggest that about 6 to 10% of patients in intensive care don't leave intensive care alive. Or to put it in different terms, about 90 to 94% of intensive care patients do survive their stay in intensive care and leave intensive care alive. It also means that the vast majority of patients in intensive care are leaving intensive care alive. First of all, let's quickly look at why critically ill patients in intensive care need to get into an induced coma in the first place. As a rule of thumb, anybody who's requiring mechanical ventilation and a breathing tube will also require an induced coma. The simple reason for that is that mechanical ventilation and a breathing tube are so uncomfortable that it can't be tolerated without being induced into a coma. I put a link below this video in the written version of this blog about induced coma in general. And the title of this article and video is, What is an induced coma and why is my critically ill loved one in an induced coma? So you can get more general information there what an induced coma exactly is and why it's needed. So patients in intensive care therefore have to be sedated with medications to put them to sleep, again so that they can tolerate the mechanical ventilation and the breathing tube. You can find the most common clinical pictures in intensive care when patients have to be sedated, induced into a coma, and then go on a ventilator and a breathing tube if you check out our section about clinical pictures in intensive care. Most of those clinical pictures there all require sedation and an induced coma most of the time. Again, I put a link towards our clinical pictures in the written version of this blog below this video. And you can also find the section on the top left side of the website where it says Intensive Care Insights, and you can find the clinical pictures there. Let's look at all of this from a more practical point of view, and let's illustrate this with some practical examples so that you can understand how this might look like in reality. Let's just say your 80-year-old dad has been admitted to intensive care with a severe pneumonia, and he needs a breathing tube due to his oxygen levels dropping significantly. He wouldn't be able to be kept alive without starting to ventilate him as his lungs are just too sick. Your dad therefore needed to be sedated and induced into a coma so he can tolerate the breathing tube and the ventilator. This will do two things for him. It will give his lungs the ability to rest and heal, as well as give his lungs more oxygen and more pressure so that the lungs can deal with the pneumonia. And number 2, it will give your dad's body a rest and he has more time to deal with this severe critical illness. It's always difficult to put an exact time frame on how long your dad will be in the induced coma and how long he will need the breathing tube and the ventilator, and it will also be hard to say if he will survive or not. From that perspective, intensive care is an inexact science. You can certainly improve the chances of getting your dad out of intensive care alive by doing your own research, by asking the right questions, and by not buying into the negativity and the doom and gloom of the intensive care team. It also helps if you get professional help through my one-on-one counseling, consulting, and advocacy service here at intensivecarehotline.com. Chances of survival, generally speaking, also increase if your dad was otherwise fit and healthy before he went into intensive care. Many families in intensive care who ask this question, what are the chances of survival for a person in an induced coma, also ask this question because they often feel the pressure from the intensive care team to agree to a withdrawal of treatment and or NFR, not for resuscitation, or DNR, do not resuscitate orders. Intensive care teams are very quick in being negative, and they are very quick in painting doom and gloom pictures for your critically ill loved one. If you buy into the negativity of the intensive care team, you are doomed, and you will fall into the category of 99% of the families of critically ill patients in intensive care who make no informed decisions, who have no peace of mind, no control, no power, and no influence. Therefore, if you ask the intensive care team about what are the chances of survival for a person in an induced coma, you'll probably get a negative answer, and you'll get an answer that's driven by what's happening behind the scenes in intensive care. You, therefore, have to read between the lines at all times. You may also want to know, why should I be the one telling you about all of this? In case you are wondering, after nearly 20 years intensive care nursing in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also worked as a nurse unit manager in intensive care for over 5 years, I can assure you that I have seen enough patients in intensive care surviving an induced coma. Furthermore, now in my professional counselling, consulting, and advocacy service here at intensivecarehotline.com, I speak to families in intensive care all over the world every single day of the week. I know your questions, I know your frustrations, and I know how to get results for you. Let's quickly look at another real-world example here. Let's say your 53-year-old husband was in a car accident and sustained significant fractures on his chest, his hip, his legs, and he also sustained a significant head and brain injury. He's now been in an induced coma for over 2 weeks. First, he had very high intracranial pressures, also known as ICPs, that had to be surgically managed as well as medically managed. Once your husband's intracranial pressures were under control, after he had brain surgery, a craniectomy, which is basically a partial removal of the skull, as well as medical management with mannitol and thiopentone, he had all his other fractures in his hip and legs fixed. Your husband also required significant amounts of inotropes or vasopressors because he developed an infection that caused his blood pressure to drop, as well as him needing some antibiotics. With all this extensive surgical treatment and the need for anesthetics, as well as deep sedation and opiates are painkillers, for his significant head and brain trauma, he's still sedated and he's now got a tracheostomy. Your husband has been very critically ill, and especially with his high intracranial brain pressures, or ICPs, he was close to not surviving this ordeal. Your husband has now been in an induced coma for 3 weeks, and the sedation has just come off now. He's not waking up yet, And in order to come out of the induced coma after the multi-trauma and the head and brain injury, he will need time. It's often time that intensive care teams are not prepared to invest in their patients, because an intensive care bed is a precious, expensive, scarce, and in-demand resource that other potentially more profitable patients want as well. That's why it's so important that you do your own research, and that's why it's so important that you do whatever it takes to challenge the negative positioning of the intensive care team. Your job is to position your critically ill loved one's diagnosis, prognosis, as well as their care and their treatment. Especially when it comes to multi-trauma and severe head and brain injuries, critically ill patients will need time, patience, nurturing, and a positive environment. How do you feel intensive care teams are going in providing a positive, nurturing, and patient environment when you feel pressured from day one to agree to, quote unquote, pull the plug, so to speak? That's the reality, and most families come to us at intensivecarehotline.com when they feel the pressure from intensive care teams to agree to a withdrawal of treatment or an NFR, not for resuscitation, or DNR, do not resuscitate orders. You see, the reality is that most critically ill patients in intensive care survive an induced coma if they are given the time. It's often time the intensive care team is not prepared to give. They also believe that they are the only ones who know what's, quote unquote, in the best interest for a critically ill patient, and that means for your critically ill loved one. From my perspective, it's bollocks. The fact of the matter is that you know your critically ill loved one best, and you are their best advocate. If I was you, I would not buy into the negativity and the doom and gloom of the intensive care team. And if I was you, I would buy as much time as possible if you can. Don't go into any meetings with the intensive care team if you are unprepared. A family meeting in intensive care is the ultimate power display for the intensive care team, and they know what to say, they know how to say it, they know when to say it, and they also know what not to say. That's how they manage their beds in intensive care, and that's how they manage families in intensive care. 99% of the families of critically ill patients in intensive care blindly follow the lead of the intensive care team, and that lead is almost always a negative lead. 99% of the families of critically ill patients in intensive care don't know what they're doing, and they don't know how to make informed decisions, get peace of mind, control, power, and influence. Once your critically ill loved one has survived the induced coma, your next step is to look at how long it'll take them to wake up after the induced coma. And again, I put some links to some more reading and articles below this video in the written version of this blog. You can check out another article and video about how long does it take to wake up after an induced coma. And also another article and video, how long can you keep a critically ill patient in intensive care in an induced coma. By watching this video, you're on the right track. Do never give up and get as much information as you can possibly get before agreeing to anything or before believing any of the negativity and the doom and gloom of the intensive care team. Thank you for watching. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.